Welcome to the Comprehensive Center for Joint Replacement at Trumbull Memorial Hospital. This program is created to change the way patients and their families think about and experience hip and knee replacement surgery. Structured around the fundamental principles of wellness, the program is patient-centered and aimed at giving you the knowledge and tools to make the transition from hospital to home as smooth as possible. From our pre-testing staff, who will screen and prepare you for surgery, to our physical therapy staff, who will teach you mobility and exercises, we believe in consistency. Before surgery, you will attend a pre-op class where you'll receive information on what to expect before, during, and after your joint replacement. You are encouraged to have a friend or a family member act as a coach as you go through the joint replacement process, beginning with a pre-op class and continuing through the recovery process. Our joint care coordinator will work with you and your doctor to coordinate your entire care experience and answer all of your questions. We are determined to make your joint replacement experience as comfortable as possible. Our amenities include an informative pre-op class for patients and family, a patient guidebook with surgery preparation and aftercare tips, all private suites. You get to wear your own clothes, no hospital gowns for our patients, unlimited visiting hours with your coach, daily walks on our Around the World tour, group therapy twice a day, daily newsletters, educational flip charts answering patients' most frequently asked questions, educational classes for you and your coach, a reunion celebration approximately 12 weeks after surgery. Right outside of your hospital room is our walking circuit. Experience shows the sooner our joint replacement patients start walking after surgery, the greater mobility and success they'll enjoy when they leave. Every 50 feet you walk, you'll reach a new travel destination and level of independence. The group therapy room is also located on our floor, just a few feet away from your room. Twice a day, you'll be escorted here where you will join other patients. Together, you'll learn how to use your new joint, improve muscle strength, flexibility, and range of motion. A joint care experience you're not likely to forget. Group therapy will give you and the group encouragement you need to get your body and your life back on track again.
Pain control is a very important part of our program. We use an innovative triple approach to pain control that keeps pain at a minimum, so you're able to get up and walking approximately 2 to 3 hours after your surgery.
The first 3 surgeries at other hospitals were horrible. I woke up after surgery. I was heavily medicated. Pain on a scale of 1 to 10 was probably 1,000. And I came here, had surgery. Woke up after surgery, I wasn't overly medicated, and I was in no pain.
From the day you decide to have surgery at the Center for Joint Replacement at Trumbull Memorial Hospital until the day you head home, our staff will provide you with everything you need to help you get back to a better quality of life. We're a national award-winning program. We're the first program in Ohio to achieve advanced certification for hip and knee replacement from the Joint Commission. We're also the first destination center of superior performance for joint replacement in Ohio, and we're a center of Blue Distinction Plus from Blue Cross Blue Shield. We believe the key to better outcomes is a commitment to provide you with a thorough understanding and knowledge of what to expect during your surgical experience. Knowing what to expect goes a long way to reducing stress and anxiety and preparing you for as smooth a recovery as possible.
The Center for Joint Replacement not only got me back on my feet quickly, but I got my life back, the life that I had enjoyed before, and I continue to do so.
We know you have a choice of where to go for your procedure. Our goal is to ensure your stay with us is as pleasant and comfortable as possible.
I'm Susan DeLeo with WKBN Health Chat. I'm here at Trumbull Regional Medical Center with Dr. Tom Jones. And Doctor, as a board-certified orthopedic surgeon, when is it time to have surgery?
First and foremost, the decision for anything more than conservative treatment is a personal decision. Individuals should exhaust all conservative measures prior to contemplating surgery. certainly discussing that with your physician is of utmost importance. And arthritis medication, weight loss, exercising, injections of cortisone or Synvisc or some other viscosupplementation certainly can put off the need for surgery. But the reality is when the arthritis pain interferes with your activities of daily living and you just cannot enjoy those things that you wish to enjoy with yourself or your family, that is the time to discuss surgical options with your physician and surgeon.
Yeah, so when, you go out for your morning run and it just gets harder and harder, you start at 5 miles and then you're only doing 2 miles and then it's excruciating. I mean, that's probably a good sign that you need to come in.
Certainly that's a good sign. It centers around your activities of daily living and pain. Certainly family members' input into that decision is very important. Any surgical intervention that you wish to entertain with your physician will involve family members, both before surgery, during the day of surgery, and following surgery.
Mm-hmm. I mean, that's a good point because, mom and mom might want dad to have surgery, but the family said, oh, I don't know if we're ready. So good advice.
That's correct.
Yeah. Thanks so much, doctor, for your time. And for more information, go to wkbn.com/chat.
My name's Ernie Kellerman. I'm a former Cleveland Browns defensive back. In fact, I played in the NFL for 9 years. I had a previous knee procedure done when I was in high school to have a torn meniscus repaired. I had some knee experiences as a professional player, and I think that had to do with some of the knee problems I've had just most recently in the last year. I was having everyday issues, whether it be walking. I used to like to jog quite a bit just to maintain shape and that sort of thing, and that I had to stop jogging. So I've seen one, maybe 2 orthopedic specialists, Dr. Hergenroder being the one that came highly recommended. He determined that the total knee replacement was something that was in order and that I should seriously consider, which I did. I just feel in the initial stages of getting ready by the medical people at Trumbull Regional Medical Center that I was well prepared for the procedure. I do recall going to the pre-op course where they give you a good characterization of what you could look forward to and what's going to happen. There were no surprises, I think, when you did finally go in and have the procedure done. The procedure was a success, and the very next day I was in one of the classes where we were doing knee exercises to help the knee get back to some degree of normalcy. I've always been a very active person and love to do things outdoors, and I feel this has given me an opportunity to get back to where I once was before. They do a phenomenal job there at Trumbull Regional Medical Center, and I would highly recommend that hospital to anybody interested in having a knee procedure or other types of procedures.
I'm Susan DeLeo with WKBN Health Chat, and we're here at Trumbull Regional Medical Center with Dr. Hergenroder. And doctor, as a board-certified orthopedic surgeon, what is arthritis?
Arthritis is 3 things. It's inflammation of the joint lining, which causes swelling. It's wearing away of the articular surface, the white gristle that covers the bones at joints, either partially or completely. And it's new bone formation or bone spur formation. So
it's no wonder that, as we get older, we're just more in pain.
It occurs more in certain people than other people. A lot of it is genetic. A lot of it has to do with trauma. In other words, you get people in sports medicine and they suffer joint injuries, and of course that leads to destruction of the joints over a period of time. It can also be affected by obesity. It can be affected by people's jobs. It can be affected by inactivity at all. That's why we recommend a lot of activity to people, because it actually maintains their joints a little bit. It lubricates them better and makes them more functional.
And see, the problem is for older people, they don't want to move because they say, oh, it hurts. But in reality, we have to move more, right? So it hurts less?
Well, the problem as we age is the articular surface starts to wear away. The articular surface it shields the underlying nerve ending. So as that wears away, the surface is rough, and we lose that coefficient of elasticity that makes us move so quickly. And then when it's completely gone away, it's like sandpaper on wood, and people just don't want to move at all. And of course, the nerve endings are exposed, they're being stimulated, and it's painful.
And you talked about, we don't see 80-year-old people usually running in the Olympics.
That's
right?
correct. They don't move very quickly because the joint surfaces are like sandpaper on wood, and they don't move quite with the way we did when we were children.
So, doctor, for folks out there suffering from joint pain, what should they do?
What they should do is try to be active. That lubricates the joint, makes them move better, lose a little weight, be active, maybe take an anti-inflammatory.
And for more information, go to wkbn.com/chat.
Hello, I'm Seth Kulick. I'm one of the new hip and knee joint reconstruction guys at Youngstown Orthopedics. So the biggest advantage of using the Mako robot, it's a tool. It allows you to place your components where you intended to place them. The biggest issue with a traditional joint is that we're not perfect, so our cuts may be off, and while we do excellent surgeries and produce great joints, this provides an extra level of precision that was previously not available. The Mako produces a very predictable, reliable joint replacement, and when I leave the operating room, I'm confident knowing my implants are where I intended to place them.
I was at my office and I just started to feel funny.
I was walking down the hall. He was coming in. He was grasping his chest.
It was like any other day at the fire station. We were here and the call went off.
My name is Jim Franks and I'm a practicing attorney here in Trumbull County. Back on, it was the 17th of November, I was at my office up the road in Cortland, preparing to take some things to downtown Warren to file. And it was kind of funny because I had not had what I would call symptoms ahead of time, but I was at my office, my hands started to ache, and I didn't think anything of it until I broke into this cold sweat. And I knew from watching TV ads and so on and so forth that a sign of a heart attack was breaking into a cold sweat. First thing I did is I got on the phone, and my wife answers the phone, and she's like, "What's up?" And I said, I think I'm having a heart attack, but I'm going to drive down to Bob's, which is Dr. Naples' office. That's what I do. I stumble out of my office, get in my car, and drive down to Bob's office. One of the nurses, as I walked in, said, "Can we help you?" And I said, "Yeah, is Bob here?" And she goes, "Well, yeah, can we help you with something?" And I said, "Yeah, I think I'm having a heart attack." And she says, "Well, come with me." So she walks me down the aisle, and actually as I'm walking down the aisle, Bob's coming up the aisle, and she goes to put me in one of the examination rooms, and no sooner do I get to that room, I go down.
So he's having this chest pain, and it's a very significant amount. One of my nurses was doing the EKG, another one was taking the vitals, blood pressure and heart rate. Someone else was calling 911.
The call was approximately 10 in the morning, and just receiving the call, you're obviously on heightened alert.
And we responded to Dr. Naples' office in Bezetta. When we got there, the patient was in one of the rooms, and as we walked in, we could tell that something was wrong. His color just wasn't very good at all, and he was very anxious and appeared to be in some distress.
So we get him somewhat stabilized. Paramedics are here. I made a phone call to Dr. Nador, the cardiologist. He got the cath lab ready.
On the way to Trumbull, we started 2 IVs on the way in and got into the emergency department, met with the cath lab staff, and then took the patient straight to the cath lab. When you're dealing with the heart, time is tissue. From the time that we left our station here until the time that we pulled into the emergency department in Trumbull was 20 minutes.
That artery that was 100% blocked is 100% open now, and he's a very lucky individual.
All the dominoes just fell into place. If one thing is different, I'm not here. You can forget about the physical aspect of it. It was the emotional aspect of knowing you have survived and you have a life afterwards.
I'm Susan DeLeo with WKBN Health Chat. We're here at Trumbull Regional Medical Center and with Crystal Alexander. So Crystal, as a physical therapist, you've had your surgery. Now what's the next step?
Well, the next step is rehabilitation. So say you came in and you had your hip replaced. You would come in the day of surgery, have it done. We would see you about an hour or two after you come up from the recovery room. We kind of get your evaluation for therapy started at that point. We get you up, get you moving. We'll take our first steps.
Literally, right? I
Absolutely.
mean, like you're going to make me get out of bed and I just had my hip done?
Mm-hmm. So we try to get you up and walking within hours after you get up from recovery.
Okay, and so then there's group therapy, right? So you're in a group.
Group therapy will start the next morning. We have 2 therapy classes that you attend the day after your surgery. We have a class in the morning and then a class in the afternoon. And basically at that point you're going through the exercises with all the other joint replacement patients as well. We practice getting in and out of the car, up and down the stairs, walking, anything you have to do to get you as independent as we can before you walk out the door.
Nice. So the steps behind, there's wooden steps here. So I just had my hip done. I'm actually walking up the steps.
Yes.
Like, that's just unbelievable how fast you want your people to be moving.
Yes, we want you to be as independent, like I said, as you can before you leave. You have to be able to get in and out of your house, attend your outpatient therapy afterwards. So
thank you. Thanks, Crystal. For more information, go to wkbn.com/chat.
My name is Matt Ozanich. I'm the Director of Pre-Hospital Care for Trumbull Regional Medical Center. We have a 29-bed emergency department equipped with 2 trauma bays. We are a level 3 trauma center. We also have 3 cardiac rooms. We are a cardiac center as well as a resuscitation center, and we can do emergency catheterization in the event of somebody's having a heart attack. We also have a few community initiatives where EMS, bringing a patient to us, can actually activate in-hospital protocols. So if somebody's coming in with a stroke, EMS can call in a stroke alert. They can go straight to the CT scanner and bypass the emergency department. If EMS is coming in with a heart attack, they can call in and say, we're coming in with a STEMI patient. We can actually get the cardiologist activated based on the EMS recognition. So just trying to improve times and improve patient care.
I'm Dr. Larry Woods. I am an interventional cardiologist and cardiac intensivist at Trumbull Regional Medical Center. We take care of chest pains that come in 24/7. We have a 24/7 catheterization laboratory where we take heart attacks, put stents in emergently. There's a whole crew of cath lab as well as cardiologists.
My name is Meeta Raheja. I'm an electrophysiologist, which is a subspecialty of cardiology. At Trumbull Regional, we are equipped to handle all electrophysiological procedures or problems, including treatment of atrial fibrillation, ventricular tachycardia, and taking care of defibrillators. I work hand in hand with the interventional cardiologist and the general cardiologist at Trumbull Regional Medical Center.
My name is Shelley Lamb, and I am the Operations Manager for Medical Imaging for all of Steward Healthcare and around the Valley hospitals. Here at Trumbull, we offer a full line of imaging, including CAT scan, MRI, nuclear medicine, a mammography, regular x-ray. We do have 2 interventional radiologists here, so we do a lot of hip injections, paracentesis, thoracentesis, CT biopsies, ultrasound guided biopsies. We do a lot of breast localization. We place clips.
Hi, I'm Steve Varconi. I'm the Program Director here at Trumbull Regional Medical Center's Wound Care and Hyperbaric Center. As you can see behind us, we have one of our hyperbaric chambers. Patients can go in the chambers, and the oxygen really helps get into the bloodstream to heal that wound from the inside out. So you're getting wound care on the outside from the clinic, but then getting treatment from the inside out. You do not need a physician to be referred to the wound care center. With the wound care that we provide in the center, there's a bunch of metrics that we can meet, and by meeting those metrics have awarded us Center of Distinction and Center of Excellence since 2015. So it's something that we take a lot of pride in down here, and that comes from the fantastic network of physicians we have along with the nurses.
Hi, I'm Ruth Ann Sanfrey, and I had a knee replacement. I'm very active senior citizen, and I'm glad I'm back to being an active senior citizen. Prior to surgery, I was not very happy because I couldn't get around as well as I wanted to, and I was very frustrated being that it was holding me back in my everyday activities. The pain that I had in my knee kept me from being able to go to my grandchildren's sporting events. To walk the bleachers was a little difficult. To stand in the kitchen to cook was a little bit harder because of the pain in my knee, and just doing household chores was very hard to do with the pain and that I was having. My preparation prior to surgery was very informative, and I learned a lot. I felt that I was very well prepared for my surgery. My pain after surgery was very minimal. Even when I went home, my pain was very well controlled and minimal. I was in the hospital 2 days. I used the walker for 2 weeks. It took me 5 weeks to walk a mile. The best thing that surgery has allowed me to do is to be able to take care of myself and be pain-free and walk and bicycle and play with my grandchildren. I'm very appreciative of all of the care that the Center for Joint Replacement gave me. I'm able to do all of the things that I wanted to do and even a little bit more.
My name is Leslie Dunlap. I'm 53 years old. I am the owner of Fifth Mountain Therapy, Fatty Cake Soap Company, which of course is the best soap company in the world, and Basic Faces. I have an extremely active lifestyle. I don't stop. At work, I'm on my feet all day. I try to make other people feel better. The joint pain before surgery was really debilitating. I had a hard time at work. I'm on my feet all the time. I'm on my feet with my patients and my clients. I'm on my feet with making the soaps, and it was getting extremely difficult. Even when I sat down to work on my clients, it was extremely painful. I kept adjusting, oh, why is this hurt? Why is this hurt? Why is this hurt? There were times I actually cried. I cried, usually in the middle of the night when I couldn't sleep. And then of course, my personality, my go, 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 was stop, stop, stop. And that really hit my head hard. It was extremely depressing to have that much pain. I said, this is enough. I have to go see Dr. Jones. My hip replacement at the Center for Joint Replacement at Trumbull Regional Medical Center, there were no lapses in information. They told me everything that was going to happen, when it was going to happen, how it was going to happen, and if I had questions to ask, and I didn't even have to ask because they were answered ahead of time for me. After surgery, my couple of biggest goals was actually to get back on my motorcycle, four-wheeling. We do a lot of four-wheeling. We have a camp in Kennerdale, Pennsylvania. Hiking, we did a lot of hiking. Short-term recovery, I was back to work in 3.5 weeks. I was on a lighter schedule, which is fine because it was just my energy level that took time to come up. There was no pain. And like I said, once the pain was gone, all bets were off. I was on a go. If somebody was on the fence with the positive experience that I had, I would tell them, yeah, please go check out the Center for Joint Replacement at Trumbull Regional Medical Center. My experience was phenomenal.
I'm Susan DeLeo with WKBN Health Chat. We're here at Trumbull Regional Medical Center with Dr. Ken Jones. And doctor, as a board-certified orthopedic surgeon, can you tell us what is a typical hospital stay post-surgery?
We get the patient evaluated. We have them come to the hospital. They take classes, watch videos. So by the time they have their total joint replacement, their questions are answered, and the staff at the hospital gets to know them and their needs. So the important thing is to be prepared going in. So when they do have their joint replacement, they come in the day of surgery, and typically you have the joint replacement, and the vast majority of the people are out of the hospital within 24 hours. We don't have patients sit in the hospital for 4 or 5 days like we used to. Most of them, the vast majority of them, actually go home, and some of them, even if they're really healthy, can leave the same day of surgery.
I love the part about the pre-planning because, that's like the worst nightmare is that the patient comes home from the hospital and the family's not ready they don't know what to do.
So to help with the family education as part of the pre-planning, we have the patient pick a coach, someone that is a family member or a friend that will help them through the process. They are with them in therapy at the hospital. They are there, so if, sometimes if you're on a little bit of pain medicine, you don't remember anything, the coach will be there to get the questions answered and to know what to do. They're taught by the therapist on their exercise to do at home. So by the time they get home, through all the preoperative process, the process goes a lot smoother, and as a result, your complication rate goes almost to zero because people know what to expect. They know when to call the doctor, and they know what activity to do.
Great. Well, thanks so much, Doc. For more information, go to wkbn.com/chat.
My name's Ron Bierman. I'm the president of Trumbull Regional Medical Center. On behalf of everyone here at this hospital, I truly want to thank law enforcement for everything they do on a daily basis.
I'd just like to take this opportunity to thank all of the law enforcement of Trumbull County for their hard work and dedication.
We recognize how difficult and challenging their job is, and we view them as a critical partner. Whenever we need them, they're here.
Thank you for your service.
At Steward Medical Group, our physicians and advanced care practitioners provide outstanding, compassionate care. Whether you need a doctor who is close to home or work, we can help. Visit us online at www.steward.org and click on the Doc Finder link. or give us a call at 1-800-488-5959.